Well, pollen is a big problem for a lot of us right now, but for some people, the congestion is something much worse.
We're talking about something called chronic sinusitis. Surgery has been a last resort because of painful side effects associated with it. But as Dr. Mallika Marshall shows us, that's all changing.
Here's a lilac.
Yeah, it's beautiful, isn't it?
You can smell this now?
I can smell everything in my yard now.
Breathing freely. It's something Lori Whalen of Plymouth forgot how to do.
I had a great deal of pain and pressure here, in here, all through my head.
Like about 1 out of 7 Americans, Lori had chronic sinusitis. That's when the sinus tissue is so inflamed, fluids don't drain and can become infected.
Just a constant malaise for like 2 months, just feeling horrible. And then finally a fever of like 102. I went to the doctor. She's like, yeah, we need to get this taken care of.
That led Lori to Dr. Anit Patel at the BI Deaconess in Plymouth. He is now doing a less invasive method of sinus surgery.
It's a big difference, yeah. And you know, traditionally with sinus surgery, you're removing a lot of tissue and bone. These days, we don't do that.
Instead, with a slender probe and a video monitor, he can avoid any incisions and still open the passageways by removing diseased tissue. Then he implants this device. It's called Propel.
The Propel implant is...
A company video shows how after the sinuses are cleared, the device springs open while emitting a localized steroid over several weeks. It slowly dissolves while keeping inflammation down.
And that steroid is only local, as opposed to taking a steroid by mouth that can have side effects throughout the whole body.
Recovery from the procedure is a big improvement.
Traditionally, you're out of work for about 2 weeks or 3 weeks or so. You have these large packs that come out of your nose, you get the black eyes, and patients can usually get back to work within a few days, if not the very next day.
Was there any pain at all?
No pain, none. It was the most pain-free thing. Like I said, dental appointments, cleaning is worse.
Anyone with a pollen allergy knows the past couple of months have been brutal. Conditions like that can make sinusitis that much worse.
The pollen count has been sort of sky high. And so when you're inhaling the pollen, it lands in the tissues in your nose and it causes swelling of that tissue.
Pretty yellow lilies.
Not for Lori. She got everything planted the way she liked this spring with barely a sniffle. Dr. Mallika Marshall, WBZ News.